Today I want to give you some information about the ultrasonic rhinoplasty operation. First of all, I'm going to tell you the details of the rhinoplasty surgery, and then I will go into the detail of ultrasonic rhinoplasty and give you some detailed information about the differences of an ultrasonic approach to the nose job operation. First of all, we usually prefer to use an open technique of rhinoplasty. Why? Because we want a better exposure of bones and cartilages. We first of all start our operation with shaving the hump region of the nose. You know, in many of the patients, the nasal hump is a major problem and it's a part of aesthetic rhinoplasty operation. Nasal hump is the area that located in the dorsum of your nose, which is a ridge-like bony extension on your nose, and we carve or we rasp out the extra bone and extra cartilage, which gives you that hump look on your nose. After we harvest some cartilages and we shape the middle cartilage of your nose, we come to the step of narrowing the nasal base of your nose. In many of the patients, which gives the nose a very large, a very wide diameter, is the nasal base. Okay, now I will briefly give you some information about the advantages of ultrasonic rhinoplasty. Ultrasonic rhinoplasty has a special instrument. It's called the ultrasonic osteotome, that when you put it over your finger, it does not cut it, because it does not cut the soft tissues. When you put it over the bone, it selectively cuts the bone. So this is an important reason why we prefer that instrument in our rhinoplasty operations. Because by being a selective instrument, it does not damage the vessels, it does not damage the nerves or muscles. That's why after ultrasonic rhinoplasty operation, we do not observe too much swelling and bruises around the eyes. It significantly improves the healing time, and the patients feel much more better after ultrasonic rhinoplasty operation. Okay, now let's talk about the aftercare of ultrasonic rhinoplasty operation. After the operation, the patient should stay one night in hospital, and then we discharge the patient with proper medications such as the nasal decongestants, nasal sprays, and some ointments for her nose. And then as a doctor, I want the patients to stay in Istanbul for 1 week, because we put an external and an internal splint to the nose of the patient, and as a surgeon of that rhinoplasty operation, I want to see the early result of the operation, because in many of the cases when we remove the external splints and internal splints, we have to do some minor manipulations to the bones to check the alignment of the bones. So it's very important that we should see the patient in the first week after the operation. The patients can then travel to their countries after that 1 week period, and they can go rhythmical walking, they can start soft exercises, but for fitness exercises or strenuous exercises, they have to wait for at least 4 weeks. The early phase of bone healing is completed after 2 months. So during that period, the patients shouldn't use sunglasses or eyeglasses at all. And then they can return back to their normal life. In many of the cases, if it even occurs, the bruises and swellings around the eyes disappear around 10 days. And after that time, they can return back to their work or they can go to school. So a 10-day of resting total is enough for most of the patients.